COVID-19 concerns continue with headlines focusing on the Delta variant, but John Sanders injects some important facts into the COVID discussion. John is Senior Fellow in Regulatory Studies and Research Editor at the John Locke Foundation, and he recently wrote about the latest data involving excess deaths. Before we focus on what you found, remind us, what is an excess death?
So excess deaths are a thing that the Centers for Disease Control and Prevention the CDC, use for tabulating whether there's something unusual happening in a state as far as deaths go. With something like COVID or like the really bad flu of 2018 and 19, it's hard to disaggregate what's causing the deaths. Was it the virus? Is it pneumonia? Is it, there could be some uncertainty as to what's causing deaths. So CDC looks at all causes of deaths, and they have a way of going, looking over the last few years, tabulating what would be the expected amount of deaths in a week in that state, in North Carolina. And if the amount of deaths in that state exceed the 95% confidence interval above the average, that means something unusual is happening. It's a 1 in 20 year event. It's like a 1 in 20 year flood. It just means something's unusual happened. The health officials need to investigate. They're called excess deaths.
And COVID-19 has produced excess deaths, but as your latest research brief on this shows, North Carolina has had no excess deaths from COVID since the middle of March.
That's right. So from late May, early June on of last year, with the exception of a few weeks in last summer, up until mid-March, North Carolina was having excess deaths owing to COVID. We were also having excess deaths that were not related to COVID, but that's a different matter and a subject we've talked about before. But since mid-March, we have not been having excess deaths owing to COVID.
And that, I think, might shock some people who are hearing about this Delta variant and the rising number of cases and hospitalizations. This is a data point that's very different from that narrative.
Right, because we've kind of gotten used to, well, if the cases are going up, then, obviously deaths and hospitalizations are happening along as well in the same proportion. But we're not seeing that anymore, and I think what we're seeing is the effect of vaccination, the effect of natural immunity, and also as the virus is mutating, which is what the Delta variant is. But when the virus mutates, it's trying to be able to replicate itself more and not kill off its host. This is part of the process of a virus going from a pandemic to something that's more endemic. Eventually, COVID is going to fade into the other coronaviruses and flu viruses that make up the common cold.
And that's something we never hear about. Let's talk about some of the other aspects that are interesting from your research brief. One of them is that even though you know that the number of excess deaths from COVID has not gone up or has been gone since the middle of March, that's not really because of the work of the State Department of Health and Human Services. You've had to do some extra work. Why is that?
Yes, because for whatever reason, our Department of Health and Human Services is 5 months behind the rest of the entire nation in reporting all-cause deaths to the Centers for Disease Control. The rest of the United States is reporting into July, through July 17th when I wrote that last week, whereas we have partially reported data through February, I think, 26th. So we are dramatically behind the rest of the nation.
And being that behind has to have some impact when you're having public officials making decisions based supposedly on data.
Well, and that's what my main concern is with the non-COVID excess deaths is because we don't have the all-cause deaths. We only know what DHHS has put out as far as the COVID deaths. So I have those data, and I can compare those with the Centers for Disease Control's their estimates. And that's how I'm able to find out whether or not we've been having excess deaths. I did this last year. We actually predicted the 3 weeks last summer that did not have excess deaths, even despite the DHHS's lax reporting. So now we haven't seen them since mid-March, which is showing a decoupling of deaths from cases, and that's really good news.
One of the other things that you point out in this research brief is that if we have no excess deaths from COVID, and we haven't had them since mid-March, it really should cause us to question whether we need to have a state of emergency, and you point to a number of factors that suggest that we don't.
Right. So we're not having the excess deaths. So that alone is suggesting that we are not in an emergency situation, especially not something that can't be dealt with by the legislature, which is what a state of an emergency was originally supposed to do. You know, if we can't get the legislature into town quickly enough to respond, then the governor should have these kind of emergency powers. Well, he's been abusing his emergency power since last March. Secondly, the threat-free index is extremely high. At last count, it's 99.8%. Last week, it's about that this week. I think it's 99.7% because there are more cases owing to Delta.
And that's the percentage of people who pose no risk. So nearly 100%.
No risk. Yes, that means the people that you encounter, you got a 99.7% chance of not encountering in somebody that even poses a risk to you. At which point you'd still have to be around them, close to them, around them for 15 minutes or more. Your risk factors also count in this.
One of the other things you point out is that if there isn't any data that really justifies a state of emergency, then it would point to this notion that this is all political and perhaps just to get federal funds.
Well, and the governor has said so directly. It's even in his executive order, his last one, as well as the previous ones. He has stated overtly this state of emergency is to draw down federal funds. And I don't think that is right. I think that's a novel justification. The fact is that North Carolina is one of the minority of states now with emergency orders. And I just don't believe that the majority of U.S. states are giving up a chance to get federal funds. So I don't believe it.
If you'd like to learn more, including the headline that's far in contrast to what we hear in the rest of the news, North Carolina, no excess deaths from COVID since mid-March. It's a John Locke Foundation research brief available at johnlocke.org. Its author is John Sanders. He is Senior Fellow in Regulatory Studies and Research Editor at the John Locke Foundation. John, thanks so much.
Thanks, Mitch.